When we talk about exposure to asbestos, I guess what I'd like to talk about is probably the work-related exposures. We have people who worked in factories where they manufactured asbestos, where they made it into what we called slurries. Slurries were used to wrap pipes and wrap boilers. Plumbers were very involved in this at one time. In the Navy, they sprayed it in the boiler rooms to keep the engines running strong. Asbestos was in brake pads, so people who did automotive work would inhale asbestos. Now, people ask all the time, well, I have peritoneal mesothelioma. Does that mean I ate asbestos? We don't really know. We know that in pleural mesothelioma, we know that you inhale the asbestos. We know that we can find asbestos fibers in the lung when they do what they call a dissection. If they dissect an area where there's no mesothelioma, they're apt to find the asbestos fibers there. We think what it is that it's a cascading of events, that you are exposed to the asbestos, somehow it is taken into the body either through inhaling it or swallowing it, and then it begins to form a neoplastic or a cancerous type of process. And we don't know what the triggering event is that leads it into forming a mesothelioma, but we know that there is a direct relationship between patients who are exposed, who develop the disease.